want to just follow up with you after doing some discovery calls and talk about frequent questions and frequent topics that people have brought up. Thank you to those of you that took advantage of your free discovery call with me, asking whatever questions you have about your clinical experience as either a clinician or a student. A lot of you asking questions about the shift, what it actually entails. Some coaches asking questions about mostrability. So fantastic job taking advantage of having access to somebody that can give you information that you're looking for. And hopefully now that they have that information, they can go to apply it. And most of them will be in the shift or getting mostrability and learning even more than what we talked about on the call. So just FYI, the calls are on the Red Sunday sale page, which is below. I'll put that again below for you. And those sale items and the free calls go away on Sunday night at midnight, and pricing goes up in January. So if you're trying to figure out if you can afford to get in the shift, you can. And you can now, especially since there's a sale. So let's get into what we talked about a little bit with some people today. So every time I talk to a PT student who is either first year, second year, third year, they run down the list of things that is driving them crazy. Dealing with staff or faculty at their PT school that won't answer questions with anything other than because that's what you're supposed to know, or because that's the way it's going to be on the boards, or because that's what's expected. So it's I know it's frustrating, but it's also funny for me to hear this because you guys are in the exact same position that I was in when I was in PT school, and I would ask questions and people would look at me like I had four heads. So keep asking questions, and when they don't give you the right answer, keep asking questions until they give you the right answer. But understand they won't ever give you the right answer because they don't know the answer. So when you're asking somebody who was built by the broken model, supported by the broken model, works for the broken model, has never been outside of the broken model, they can only give you broken model answers. Okay. So, how do you deal with that? How do you deal with your classmates? So you should have an easier time dealing with your classmates because they haven't been stuck in it and they're not making money off of it. They're actually spending money to get screwed over by it. So ask your classmates what makes sense. So when they say, well, we're going to do this, and you know doing this is actually wrong, you should be doing the opposite of this. Just say, well, how does that, what made you come to that conclusion? What's driving your thinking here? What are the implications? Like, if we do it that way, what are we actually looking for? So what you'll figure out is what they're looking for, their goal has nothing to do with what the goal should be. Their goal is going to be, well, we need to get more passive range of motion, or we need to calm down symptoms. That doesn't mean jack squat. Any idiot can do that. You don't need to be in PT school to calm down symptoms and increase passive range of motion. Morons do that all day long. Okay. So once they start going down that road, say, well, why would we do that? Like, is that anything different than a personal trainer with only a high school diploma would do? Like, how are we applying what we learned in the first semester of PT school when we went through a whole semester of physiology? What are we applying from anatomy? How are we applying what we went over in biomechanics? Like, how does that fit into what we're trying to do here? Those are the questions you should be asking everybody. You're not going to get any answers from your faculty. You're just going to get pushback. But hopefully, if you're asking that of your classmates, they'll start to reflect and be like, yeah, why am I doing that? Okay, so there's your answer for that. So that's what we talked about on one call. Another call, can you use 180 in a skilled nursing facility? Can you use 180 in home health? Yes, all you're doing is applying science to those patients. So had a patient or a question from a student or a prospective student say, well, I work mostly with spinal cord stroke neuro patients. I said, fantastic. I work 100% with neuro patients every single day. That's what I've done for 20 years is work with neuro patients. My neuro patients just happen to have epicondylitis, plantar fasciitis, low back pain, tension headaches, patellofemoral syndrome. Those are all neurological problems. The root cause is neurological. So I'm dealing with neurological patients just like you are. The difference is if you've got somebody with a neurological deficit from a spinal cord injury, a severed spinal cord, a stroke, something like that, you're not going to get those things to come back. So the question was, can you use 180 to reverse those things? The primary deficit after an injury like that or a condition like that? No. Once that is gone, the communication is gone from the nervous system, we're not going to refacilitate anything. Okay. So what we need to do is figure out what can we work on, because as we know, with any kind of condition, once you take away one or two or three muscles from doing their job, one or two or three or four or five or six muscles are going to jump in and compensate. So the same thing happens with a spinal cord injury or a stroke patient. You have to go figure out what muscles are now working 2 to 3 times harder to compensate for the muscles that are never going to work again. And then you have to stay on top of those secondary and tertiary muscles that are becoming inhibited. So that's what you're treating to keep them at baseline as best you can. So with those patients, we see them twice a week for a couple weeks, once a week for a couple weeks, every other week, every other month, every fourth month, until we figure out, oh, we can only go 3 months before this starts to fall apart and you can't stay up with this with your home exercises. That's when you have to come back. That's where we have to do the hands-on facilitation. Then we can set you free for another 3 months. Okay, so there's the answer to that question. The other question, well, and this comes up a lot from personal trainers and strength coaches. I have patients or clients that are doing exercise and the exercise is making them worse. So should I just stop doing the exercise? So exercise that's making people worse, even if it's home exercise programs prescribed by a physical therapist, if it's making them worse, it's because you didn't refacilitate the muscles that should be working during that exercise and they're breaking down. That's the whole point of having them come in, do a functional screen, assess individual muscles, facilitate when needed, reassess functional screen, prescribe them specific exercises for what you worked on. That's why we do that. So if I have a patient go home and they do their home exercise program and they come back and say, well, I did my home exercise program and my knee was really hurting. And I say, okay, which exercise was it that made your knee hurt? It's usually lunge walk with a twist. And lunge walk with a twist is one of the most commonly incorrectly done exercises that we prescribe. So I know I have to go back through and double check that I did what I should have done, which usually I'm pretty good at that. And then I have to go and double check that they're doing the exercise correctly, which they're usually not. So they're not taking a long enough step. They're not going deep enough. They're not letting their knee go over their toes. They're not twisting the right way. Something is going on there. So once we correct that, then they'll be like, oh yeah, that feels good. And then when they come back for their third visit, I say, how are the exercises going? Fantastic. No problems. Okay. Now, if you go through and make sure they are doing it correctly and they are having symptoms, that means you missed something. So if you don't know how to do 180, you missed a whole bunch because you don't know how to refacilitate muscles that are inhibited because you don't even know how to test for inhibition. So once you learn those two things, then you can prescribe exercise and they can do all of the exercise and not get worse. So remember, exercise does not fix anything. If eccentric and concentric exercise fixed your problem, nobody would ever get hurt at the gym. Nobody that works out 5 days a week would ever get hurt because exercise would have fixed it. That is not true. Exercise, when done with inhibition, will make things worse and make symptoms increase. So if you're giving people exercise and it's making them worse, you're giving them exercise without first getting to the root cause and reversing that. Other questions. When's the best time to get in the shift and fit lab weekend in there? So lab weekend was originally designed to be at the end of the shift. Since I designed it that way, we've had several people go through the shift and come into lab weekend only a month after being in the shift, and they did just fine. Now, there was a little bit of disconnect. I had to bring them up to speed on some things at the beginning of lab weekend, but they were still fine. Now, I would still suggest if you're going to, when you sign up for the shift, that you plan on being at lab weekend somewhere between 2 and 4 months after you get in the shift. That's when everything will make sense. That's when everything will come together. I've had people come in to lab weekend 6 months after getting in the shift. That last 2 months, they get done with their video modules, and now they have 2 months between the end of the video modules and lab weekend. They're like chomping at the bit because you haven't got the most important thing, which is lab weekend. So that's why it's best to get into lab weekend right around the end of your 4 months after getting in the shift, but you can get in at any time. Lab weekend is included in the price of the shift. Everything you need: Zoom calls, video library, lab weekend, all included in the price of the shift. The only thing that's not included in the price of the shift is if you want to do immersion day on lab weekend, where you actually come in the clinic and hang out with me and see 10, 12 patients in a row, live patients, so you can see the 180 system work from one patient to the next patient to the next patient and see how, doesn't matter who they are, I'm doing the same thing. I'm not changing my thought processes. I'm not changing my treatment strategies. Little things are changing: what exercises I give them, what order I might go in, those kind of things. But thought process, treatment is the exact same. It doesn't matter who they are, how old they are, how active they are, if they're pre-op, post-op, doesn't matter. Same process. Okay. So this coming Monday, there's another round of free discovery calls. So if I didn't address your questions, or you want to know more about how I can specifically help you, make sure you're on one of those calls. Now, notice that when you get on the sale page, the sale ends Sunday night at midnight. Those discovery calls are Monday, so they're after the sale. So if you don't get into the sale, but you schedule a discovery call on Monday, I will honor the sale prices since you're not on the discovery call until it's over. You will have 3 or 4 hours after we get off the discovery call to figure out what lab weekend you're going to get in and what you're going to buy in the sale, because then the sale will be over for you. So make sure, if you want to be in the shift and be in lab weekend and you have questions, make sure you get to the link below and schedule a discovery call. Okay. I will hopefully see more of you signing up for the shift and motion ability and the student guide if you get the BOGO.